This study combines advanced MRI techniques, which were aimed to assess the various types of damage that occur in MS, which are gray matter loss, volume loss, lesions, and also an impairment of the so-called normal appearing white matter, so the white matter which is not directly affected by lesions. We wanted to combine these metrics in order to have a comprehensive view on how the MS pathology affects the cerebellum in relapsed and remitting patients on one hand and progressive patients on the other hand. And we found very interesting data on the fact that lesions are more important in relapsed and remitting patients, especially if strategically located. And on the other hand, in progressive patients, gray matter volume loss of particular cerebellar subregions are associated with either physical disability or cognitive impairment. We also went on and tried to find whether we can identify different MRI phenotypes of cerebellum damage in multiple sclerosis, and we found 3 in patients with cerebellar disability, which were presence of lesions in cerebellar connections, the atrophy of cerebellar gray matter, and a third phenotype which didn't have much brain damage, but it specifically had a severe core damage, thus producing cerebellar ataxia, probably due to deafferentiation of white matter tracts to the cerebellum.